In this guide, I'll explain the most commonly prescribed cardiac medication and how they may impact you and your ability to exercise. Also, how to manage yourself effectively so you know exactly what to do and what not to do. Hi, I'm Christian from Cardiac Rehab Online, and if you want to return to living a normal life, restore your confidence and improve your health for the future, then you're in the right place. In this video, we're looking at the role of medication in coronary heart disease and specifically what it means for heart patients. It can be complex with many types of drugs and varying actions, and most cardiac medications can be used to treat more than one problem. For example, beta blockers may be prescribed in the management of angina, hypertension, arrhythmias, or heart failure. It's not surprising that patients are frequently unclear as to why a particular form of medication has been prescribed. To make things even more complicated, drugs are referred to in a number of different ways by class or group of drugs to which they belong, and by both generic and proprietary names, for example. So for controlling the release of stress hormones such as adrenaline and noradrenaline, which makes the heart beat faster, and the generic or class of medication used for this are beta blockers. Bisoprolol, atenolol, propranolol are the proprietary names. So in this guide, I'll help you to demystify the complexities of medication in an easy to read chart. I would highly recommend you read the information leaflet that comes with your medication, and under side effects, pay attention to any signs that are listed. If you're concerned about the side effects, your first point of contact should really be your GP. Also consider that these medications are only tested in isolation. So when you are prescribed a concoction of various drugs together, which is often the case, then unforeseen effects may occur. Now remember this, that no one knows your body better than you. So the most important thing that you can do is to become more aware of how you feel. Get to know the signs and symptoms of when your body's working well and feels good, and also when things don't feel quite right. It is this inner wisdom that will help guide you to improved health and well-being, rather than doggedly sticking to a rigid regime. If something doesn't feel right with your medication, make an appointment with your doctor or speak to the pharmacist. They can always adjust it for you. When exercising, it is good practice to monitor your heart rate at various stages of the exercise session. This will allow you to cross-reference it with the modified Borg scale, which is in the free download guide called 7 Essentials of Cardiac Exercise, and that's on my website. So head over there and get yourself a copy by following the links. So the modified Borg scale works from 1 to 10 to see if your body is functioning normally. So you have to record this data over several exercise sessions by keeping a track of your exercise heart rate and the corresponding effort level. For example, John exercises 3 times per week. He checks his heart rate at the halfway point of the exercise session. It's 95 beats per minute, for example, and his effort level feels like 7 out of 10. This is normal for John. However, if John was halfway through his normal exercise session and his heart rate was, say, 125 beats per minute, and the effort level felt like it was 7 out of 10, then we can see that there may be an underlying issue here, as the heart rate is much higher for the amount of effort that he feels that he's putting in. Now, issues can range from not taking medication to the body feeling run down, a poor night's sleep, getting early stages of a cold or flu or some kind of infection. This serves as an early warning system. It helps you to identify when the body may not be working optimally, but you need to record several sessions to get an average baseline for this. So, when it comes to medication and your exercise, 2 important points. Number 1, keep a record to enable you to establish a baseline for heart rate and for perceived effort. Then correlate the two. Number 2. So it may sound too simple, but pay attention to how you feel. If something doesn't feel right, it's probably not. So get yourself checked and review your medication with your doctor or pharmacist. It's better to be safe than sorry. I hope you found this information beneficial, and ensure you download the PDF version. I've put loads of work into it to make something that can be quite complex as simple as possible for you to use as a quick reference guide, as it has the full medication tables so you can better understand the effects of medication on your exercise and your health. Guys, thank you for joining me today and to take the time to watch this video. If you like it, give me the thumbs up, and please leave a comment, share an experience that you've had with your medication, because I guarantee that the issues you have experienced are similar to many other people, and you may just be able to help someone else by sharing. Thanks again, and I'll see you all next time. Have a great day.